Hi, I'm Dr. Mukesh Gupta from Lenest Malad. Constipation during pregnancy is one of the earliest and the commonest symptoms which comes along with nausea and vomiting. And constipation is something which you have to deal with all through the pregnancy. So today we're going to discuss about the top 5 tips to manage constipation. But along with that, we're also going to discuss why is it that you land up with constipation during pregnancy, and is there any major risks or complications associated with constipation in pregnancy? So let us first quickly run through why it is that you land up with this situation. During pregnancy with the hormonal changes, like for example, the progesterone, which is in high amount, it impacts the motility of your gut. And that actually leads to slow movement of the bowels during the pregnancy. It's a mechanism that Mother Nature has created so that more and more absorption happens of the food as it passes down in its passage and its journey out of your body. In simple words, the mileage or efficiency of your gut has increased during pregnancy. But the downside is that everything that you eat, most of it is going to get absorbed and utilized and taken and stored for your baby and yourself during the course of pregnancy. So in short, if there's nothing left, how will you pass the bowels? And that is the reason constipation is very common. So reduced motility, enhanced absorption, hormonal changes, all these factors add to that the woman's inability or lack of appetite, which also affects her dietary habits in a big way. Now, coming to the top 5 tips that you need to know about how to manage the constipation in pregnancy. So in simple words, you need to understand that why this is happening, so accordingly you can take care of it. So first tip is have high fiber diet or high residue diet. So diet which is rich in fibers, for example, leafy vegetables and fruits and other things which you can have, which leaves behind residue fibers, will help you to form the bowel. Other things like the beans and so even if you're a non-vegetarian, have a lot of vegetarian diet which gives you a lot of fibers, because remember the non-vegetarian diet, if you have purely, it gets totally absorbed by your body and you don't have any fibers left behind. Besides that, you can use wheat bran or similar such things, or oats, which can help you to increase the bulk of your diet. Second tip is have lots of fluid, especially when you get up in the morning. Maybe a couple of glasses of water will help you in a very big way. It helps in creating a motility all along the gut when you have it in the morning. So many people say that a couple of glasses of warm water in the morning has helped them in overcoming this in a bigger way than any other things. You should be having approximately 2 to 3 liters of fluids in a day, which will help in doing and favoring that. Third thing is you check what other medications and what other things that you are taking. For example, if high dose of iron is being given as commonly during the pregnancy, if there is anemia, it may be one of the reasons which can cause reduced motility and more constipation. So check with your doctor, and if you need to correct that, whether you really need it or you want to change your vitamins and prenatals at that time to suit your need. Fourth important thing that we need to know is changing of your lifestyle. Little bit of activities, little bit of exercise helps you. So a little bit of walk or swimming and etc. This will help. Your stationary cycling will help you for enhancing your gut motility and thereby helping you to pass motions. Another golden tip is that try to pass your bowels immediately after you have your meals, because that is, we call it gastrocolic reflex, that helps in gut motility at that time. It helps in easy passage of bowels instead of holding it back and waiting and passing it later on and all that kind of stuff. When you really feel that, actually delaying of your passing of motions is another big problem which increases and enhances your constipation problem. Last but not the least is we need to find out if there's any major complications associated with that particular constipation issue or not, because if you have chronic constipation, it can lead to various different other problems. For example, hemorrhoids, where the blood vessels get dilated and distended. It can lead to bleeding piles, or maybe hard stools leading to fissures, etc., etc. All these things can happen, and this needs to be checked by the doctor. Last but not the least is, remember, it's not necessary that you're supposed to pass motions every day. The passing of motions depends on the amount of residual fibers which has been left behind. So don't be scared if you're not passing motions in the morning when you get up, because that fear and that disturbance leads to discomfort and irritability and restlessness, which is more troublesome. Meet your doctor, improve your lifestyle, improve your dietary pattern, have lots of fluid, and get yourself checked for ruling out if any complications is there. And that in itself will help you to overcome constipation in pregnancy. Thank you.